Great to have you with us for this edition of the Asia Business Report on BBC World. I'm Rico Hizon in Singapore. Traditional Chinese medicine is already popular at home and in many parts of Asia. It's big business, worth about $5 billion a year. But many in the West find Eastern remedies hard to swallow. A landmark clinical trial could offer proof, opening other markets for traditional Asian medicine. Juliana Liu has more.
Meet Mr. Abdul Hamid. Until a few weeks ago, he was enjoying his retirement. But then he suffered a stroke and can barely move his left side. He's taking part in the first trial of its kind. These pills could be a placebo, or they could be the real thing, made from 12 different Chinese herbs, plus extracts of leech and scorpion. They're thought to help the brain forge new connections.
Do you think you will be able to cycle again?
Yeah. This depends on your heart. If you try, can. If you don't try, won't. Everything almost try, right?
Okay, maybe you should just take the
This is one of the doctors in charge. Eventually, more than 1,000 patients across Southeast Asia will be recruited to test the stroke drug, called NeuroAiD, and originally developed in China.
By doing a clinical trial, it's the best way right now to internationally establish the safety and the efficacy of medications. And then this would help make it more acceptable to the international community, and thereby hopefully helping more people who suffer stroke.
Traditional Chinese medicine is already quite popular, though scientific proof is scarce. Now, people here in Asia have relied on traditional remedies for thousands of years. And this is a typical Chinese medicine shop. It's full of dried herbs. And here we have 3 different kinds of ginseng root. All kinds of dried roots, herbs, and even sea creatures are for sale. This man is trying to commercialize the stroke drug. If it goes well, he'd like to bring other Asian treatments to the West.
We realized that, the industry was really striving with increasing costs, with R&D, and with a mixed success, less and less new drugs being approved. And therefore we thought, why not look at things which already exist and can be taken successfully in allopathic medicine, in mainstream medicine. And that's what we've been doing. NeuroAiD is only the first product we've worked on, and the most advanced one, but we've already licensed a dozen of them in China, which are following the same path.
It'll be at least 2 years before the clinical trial yields hard evidence. For now, stroke patients rely mostly on physical therapy. But if the drug works, many more patients will be able to benefit. Juliana Liu, BBC News, Singapore.
Thanks for joining us on the Asia Business Report. Good morning, everyone. I'm Rico Hizon.